Another exciting topic on Kborkrn.com. We're going to be talking about dialysis. What is dialysis? Why do we need dialysis? Well, let's get the magic finger going here. Dialysis. Acute kidney injury, otherwise known as acute renal failure, chronic renal failure, end-stage renal disease, and or drug overdose. We've got to get those toxins out of the system. Notice the kidney function is by increased BUN, increased creatinine, abnormal GFR, glomerular filtration rate, and toxic drug levels. Diabetes and hypertension lead to kidney failure. Those are very prominent. They're familial. They're here, there, and everywhere. Family history can be prevented with diabetic meds, hypertensive meds. Take your meds. There are two different types of dialysis. Peritoneal, otherwise known as continuous ambulatory peritoneal dialysis, and hemodialysis. As we know, I'm always talking location, location, location. There we go. Okay, in peritoneal dialysis, the catheter, otherwise known as the Tenkopf catheter, discovered by some Dr. Tenkopf in the 50s, is placed in the peritoneal cavity by surgery. It's located usually in the abdominal area around this area. We will discuss peritoneal dialysis later. As I said, placed in surgery. The advantages are home and freedom. You can travel. You can do a lot of things with it. Disadvantage, you can get infections. What is the infection called? It's called peritonitis. It's from the fluids that are in the abdomen as they're doing the osmosis and diffusion, filtering the kidney waste out. It can get infected, and that would be called it's called peritonitis. And the other type of dialysis is hemodialysis. Hemodialysis is when you have tubes placed. You have them placed down in the groin, down here, right there, with a large bore dialysis catheter. You can have it placed in the subclavian. You can have it placed in the brachial artery here. You can also have AV fistulas placed. They are usually placed in extremities. They do mapping. You listen for the bruit and you feel the thrill. Make sure they're working. Dialysis is the only one allowed to access these, the dialysis catheters. We're not allowed to access any dialysis catheters unless it's okayed with the physician. There's usually a red and a blue port for arterial and venous. Peritoneal, we do that in the hospital. Most patients know how to do their own peritoneal dialysis. And that's from the tube that is placed, I said, in surgery. This one, the one up here in the subclavian, could be in the jugular also. And any type of arterial venous catheters are placed in IR or surgery. That's just a quick thing with dialysis, and I'm going to be discussing the reasons and the purposes of them later. But remember, it's all location. Peritoneal dialysis does allow the person freedom. They usually do nighttime cycling. They do it every 4 hours. And as I said, I'll discuss that later. This has been Dialysis with Kborkrn. Follow me on YouTube.